to Chennai now, where the chief minister there in Tamil Nadu, MK Stalin, launched the third dose there for the eligible people, healthcare workers, frontline workers, and those with comorbidities above 60. You see those shots on your screen of the launch that actually took place. Sam Daniel actually spoke with with the health secretary, I'm told now. Sam Daniel spoke with the health secretary. Let's hear what he had to say.
What's the plan? What's the target, doctor?
See, this is definitely not a target-oriented program, but a demand-driven. It has to be converted to a demand-driven program. There is a lot of enthusiasm. We should be able to cover the 5.75 lakh healthcare workers and the 5.65 lakh healthcare workers, 9.78 lakh frontline workers, and an estimated 20 lakh people who are having comorbidity and above 60 years, and those who are eligible, the duration they are eligible. There is a lot of enthusiasm, but more importantly, there is a, particularly with regard to healthcare and frontline workers, since the Omicron is spreading rapidly, as seen by the SG drop. We feel that it's a protection to them also to a large extent, though it may not be immediately directly beneficial to the thing. Vaccination does help in ensuring that it is less severe.
Precautions being taken to avert healthcare, senior citizens, the elderly being exposed if they are made to come to the centers.
No. See, already Tamil Nadu had a policy of doing it in the homes. Right. So that continues. Chennai Corporation only took the original step, differently abled elderly people and all. So that will continue. Having said that, these are also, even if you look at this particular original activity was people sitting in alternate thing. We have developed, ensured that, there is a proper space for, registration, administration, and staggering it. So that we have been telling, and everybody, because of the fast spreading Omicron, is very conscious about this crowding also.
Lastly, is there a concern that doctors, healthcare workers, nurses are increasingly getting infected?
No, obviously one cannot say that it is not a concern. Definitely we are concerned. We are telling hospital infection control practices have to be tightened up. We are advising visitors to avoid unnecessarily, because what happens is that, somebody comes, emergency treatment has to be on, elective surgeries so far we have not postponed. So when they come, one among them unknowingly in this particular Omicron is positive without showing symptoms. So that is why, by the time RT-PCR test is done, unless you are following the other non-medical methods to exactly. So that we have told all the hospitals, including, whether it is Vellore or GH, we had an incident. Then students unnecessarily going out to functions. Somebody went to LU here. So all of them, and we are definitely working very closely with the doctors, health workers to see that this, even though so far it has been mild.